Look, fellas, if something down there hasn't felt quite right lately, there's a decent chance it's not bad luck. It's something you're unknowingly doing every single day. And no, I'm not talking about age, genetics, or that's just how it is after 40. I'm talking about a quiet mistake that slowly chips away at blood flow, sensitivity, confidence, and eventually performance without setting off any alarm bells. Most men don't notice it until frustration kicks in. Things feel different, less reliable, less responsive, and the scary part, a lot of guys try to fix it in ways that actually make the problem worse. If you're over 40 and you assume no one ever taught you this because it wasn't important, that assumption alone could cost you years of healthy function. I'm Dr. Rosalia Viterbo, and I'm a men's health specialist who works almost exclusively with men over 40, guys who are busy, driven, and successful, but quietly frustrated because their energy isn't what it used to be. Their hormones feel off, or their sexual performance just isn't as reliable as it once was. For years, I've helped men reverse those issues naturally by getting to the root cause, not just throwing pills at symptoms. I deal with testosterone optimization, sexual health, metabolic health, and long-term performance every single day. And here's what I've learned. Penis health is never just about sex. It's a window into your hormones, your circulation, your nervous system, and your overall health as a man. So when I talk about this topic, it's not theory, it's based on real patients, real results, and real conversations I've had with men who want to feel strong, confident, and capable again. Here's what we're going to cover today. I'm going to walk you through 5 essential things every man over 40 needs to be doing to take care of his penis. And I don't mean gimmicks, supplements you saw online, or awkward advice from your buddies. I'm talking about real doctor-level guidance that actually works with how your body changes as you age. We'll talk about circulation, hormones, daily habits most men overlook, and the warning signs your body gives you long before serious problems show up. I'll also clear up some common myths that keep men stuck and frustrated, and make sure you stay with me until the end, because the final point is something I see even a lot of doctors miss, and it can make the difference between slowly declining every year or staying sharp, confident, and functional well into your 50s, 60s, and beyond. Here's the deal. Your penis doesn't exist in isolation. It's not some standalone body part that just magically works forever. It's directly connected to your blood vessels, your hormones, your nerves, your metabolism, and even your mental state. So when something starts slipping under the hood, the penis is often one of the first places it shows up. As men age, a few major things start happening at the same time. Testosterone gradually declines, blood vessels stiffen a bit, inflammation creeps up, insulin resistance becomes more common, and stress, work stress, family stress, financial pressure, piles on year after year. None of this happens overnight, which is why most men don't notice it at first. Think of it like this. Imagine your penis as a high-performance sports car. In your 20s and 30s, you could skip oil changes, push it hard, and it would still run. But after 40, if you don't maintain it properly, things start wearing down quietly. One day you turn the key, and it doesn't respond the way it used to. What most men get wrong is they assume erection problems, sensitivity changes, or performance issues are just aging or in their head, so they ignore it, or they panic and jump straight to pills without understanding why the problem showed up in the first place. Neither approach fixes the root cause. Another big issue? No one ever taught men how to take care of this part of their body. You're told how to brush your teeth, how to exercise, how to watch your cholesterol. But penis health? That's treated like a joke or an embarrassment. So guys rely on locker room advice, internet myths, or silence. And here's what really matters. Penis health is often an early warning system. Changes in erection quality, morning erections, sensitivity, or recovery time can signal circulation issues, hormone imbalance, or metabolic problems years before something serious like heart disease or diabetes gets diagnosed. This isn't about shame, it's about awareness. Once you understand what's actually happening inside your body, you can take simple, practical steps to protect not just your sexual performance, but your long-term health as a man. First, you have to protect blood flow. That's non-negotiable. Here's the reality most men don't want to hear. Erections are a blood flow event, period. Your penis doesn't decide to work. It responds to healthy circulation. Inside the body, erections happen when blood vessels open wide and allow blood to rush in and stay there. As men age, those vessels can stiffen, narrow, or get damaged from years of high blood pressure, poor diet, smoking, excess weight, or inactivity. The penis has some of the smallest blood vessels in the body, so it's usually the first place problems show up. Why this hits men over 40 harder is simple. Decades of wear and tear add up. You might still be strong, busy, and mentally sharp, but your circulation isn't as forgiving as it was at 25. A real-world example I hear all the time. "Doc, I can get an erection, but it's softer, or I lose it halfway through." That's not confidence. That's physics. What most men think works is popping a pill and moving on. What actually works long-term is improving vascular health, walking regularly, strength training, managing blood pressure, reducing sugar, and supporting nitric oxide naturally. You don't need to become a marathon runner. You need consistent movement and habits that keep your blood vessels flexible and responsive. Second, testosterone isn't just about libido, it's about tissue health. Most guys think testosterone only matters if they want more sex drive. That's a mistake. Testosterone plays a huge role in maintaining the health of penile tissue, nerve signaling, and responsiveness. When testosterone drops, which it naturally does with age, the penis doesn't respond as quickly or as fully to stimulation. Inside the body, low testosterone means weaker signals from the brain, reduced nitric oxide production, and less efficient blood trapping. Over time, that can lead to reduced firmness and sensitivity. Why this matters more after 40 is because hormone decline is gradual. You don't wake up one day low T. You slowly adapt to lower levels and assume feeling tired, flat, or less interested is normal. I'll hear guys say, "I'm just not as interested anymore." Then we check labs and testosterone is in the basement. What men usually think works is boosting libido with supplements or stimulants. What actually works is identifying whether hormones are truly optimized, not just in range, but functional for you. Hormones set the stage. If they're off, everything else struggles. Third, daily habits are either training or destroying your penis. This one surprises a lot of men. Your penis responds to how you live every single day. Sleep, stress, alcohol, porn habits, and sedentary time all send signals to your nervous system and hormones. Inside your body, chronic stress raises cortisol, which suppresses testosterone and constricts blood vessels. Poor sleep disrupts hormone release. Excess alcohol dulls nerve sensitivity. Constant overstimulation rewires arousal pathways. Why this matters more after 40 is because recovery slows down. You can't abuse your body all week and bounce back the same way. A common example, a guy sleeps 5 hours, pounds caffeine, drinks at night, and wonders why erections feel unreliable. That's not bad luck, that's biology. Most men think this is about willpower or psyching themselves up. In reality, it's about creating conditions where your body wants to respond, fix sleep, manage stress, cut back on numbing habits. Your penis follows your nervous system. Fourth, morning erections are a health signal. Don't ignore them. This is one of the most overlooked signs in men's health. Morning erections aren't about sex. They're a diagnostic signal. They tell us your blood flow, nerves, and testosterone are working together properly. Inside the body, these erections happen during REM sleep, when testosterone peaks and the nervous system is relaxed. When they disappear consistently, it often means something upstream is off. Why this matters after 40 is because many men stop paying attention. They assume it's normal aging and move on. I'll ask a patient, "When was the last time you had regular morning erections?" And they pause. That pause tells me a lot. What men think is normal aging is often an early warning sign. What actually works is investigating the cause early, not waiting until performance fails completely. Morning erections are feedback. Listen to them. Fifth, your penis reflects your overall health, not just sexual health. This is the big picture truth. The penis is often the first place we see signs of cardiovascular disease, insulin resistance, and metabolic dysfunction. Long before chest pain or a diagnosis, erectile changes can show up inside the body. Poor glucose control damages nerves, inflammation stiffens vessels, excess belly fat converts testosterone to estrogen. The penis takes the hit first. Why men over 40 need to hear this is because many are functioning but not thriving. They're getting by until they aren't. A lot of men think penis issues are embarrassing or isolated. In reality, they're informative. They're your body asking for attention. What actually works is treating penis health as a vital sign, like blood pressure or cholesterol. When you improve overall health, sexual function often improves right along with it. This was a 52-year-old guy. Successful career, married, kids grown, stayed fairly active, or at least he thought he did. He came in saying, "Doc, nothing is totally broken, but nothing feels right anymore." His erections were hit or miss. Morning erections were rare. Energy was low. Confidence had taken a quiet hit, even though he didn't talk about it much at home. Lifestyle-wise, he wasn't reckless. He worked long hours, slept about 5 to 6 hours a night, drank socially most evenings, and hadn't lifted weights in years. He figured this was just what his 50s looked like. When we looked deeper, a few things stood out. His testosterone was technically normal, but nowhere near optimal for his age and body composition. His blood pressure was creeping up. His fasting glucose was borderline high. Inflammation markers were elevated. Nothing alarming on its own, but together it told a clear story. We didn't start with magic pills. We focused on fundamentals. We cleaned up sleep first, dialed back alcohol, introduced basic resistance training, addressed stress, optimized his hormones properly instead of ignoring them, and we worked on improving circulation and metabolic health. Within a few months, the changes were obvious. Morning erections came back consistently. Erections were firmer and more reliable. Energy improved, but the biggest shift? His confidence. He said, "I feel like myself again." Not just in the bedroom, but everywhere. The lesson here is important. Nothing was wrong enough to scare him until it added up. That's how these issues sneak up on men. When you address the root causes early, you don't just fix symptoms. You get your edge back. First myth: if I can still get an erection sometimes, everything is fine. This one is incredibly common. Men use occasional success as proof that nothing's wrong. The truth is, consistency matters more than capability. Intermittent erections often mean blood flow, hormones, or nerve signaling are already compromised. The body is compensating until it can't. Waiting until things fully fail makes recovery harder. Second myth: erection problems are all in your head. Yes, psychology plays a role, but after 40, most erection issues start in the body, not the mind. Hormone decline, vascular changes, poor sleep, and metabolic health drive the majority of cases I see. When men are told it's just anxiety, they stop looking for real solutions and blame themselves. That does real harm. Third myth: just take a pill and you're good. Medications can help symptoms, but they don't fix the system. They don't improve blood vessel health. They don't raise testosterone naturally. They don't reduce inflammation or insulin resistance. Worse, they can mask early warning signs that something bigger is brewing. Pills are a tool, not a strategy. Here's the truth most men aren't told. Penis health is a reflection of overall health. When you support circulation, hormones, sleep, stress, and metabolism, performance often improves naturally. When you ignore those things, no shortcut lasts very long. This isn't about fear. It's about understanding what actually works, so you're not guessing, masking, or hoping for the best. First, erections are about blood flow. If circulation isn't protected, performance will always suffer, no matter how strong your desire is. Second, testosterone matters for more than libido. It supports tissue health, nerve signaling, and responsiveness, especially as you get older. Third, your daily habits are either helping or hurting you. Sleep, stress, alcohol, movement, and stimulation all send powerful signals to your nervous system and hormones. Fourth, morning erections are a health indicator. When they disappear consistently, it's your body telling you something needs attention. And fifth, penis health reflects overall health. Changes here are often early warning signs of bigger issues like cardiovascular or metabolic problems. When you understand these 5 areas, you stop guessing and start taking control, and that's where real improvement begins. Let's quickly pull everything together so it's clear and actionable. First, erections are about blood flow. If circulation isn't protected, performance will always suffer, no matter how strong your desire is. Second, testosterone matters for more than libido. It supports tissue health, nerve signaling, and responsiveness, especially as you get older. Third, your daily habits are either helping or hurting you. Sleep, stress, alcohol, movement, and stimulation all send powerful signals to your nervous system and hormones. Fourth, morning erections are a health indicator. When they disappear consistently, it's your body telling you something needs attention. And fifth, penis health reflects overall health. Changes here are often early warning signs of bigger issues, like cardiovascular or metabolic problems. When you understand these 5 areas, you stop guessing and start taking control, and that's where real improvement begins. If you found this helpful, do me a quick favor, hit the like button and subscribe to the channel. That tells YouTube this is content men actually need, and it helps me keep putting out straight, honest health guidance without the nonsense. I also want to hear from you. Drop a comment below and tell me what's the first change you know you need to make after watching this. Sleep, exercise, stress, hormones, be honest. I read these, and it helps me tailor future videos to what you're actually dealing with. And if you're a man over 40 and you want a clear starting point, check the link in the description. I've put together a free guide that breaks down how to support hormones, energy, and sexual health naturally, step by step. No gimmicks, no hype, just practical guidance you can actually use. You're not alone in this, and you're definitely not broken. Taking care of your penis and your health isn't embarrassing. It's smart, it's responsible, and it's something every man over 40 should be doing. I'm Dr. Rosalia Viterbo. Stay strong, stay healthy, and keep taking control of your energy, confidence, and performance. I'll see you in the next one.